the theme is unveiled in a very effective way. Minute aspects are also covered. We saw various treatment modalities, although we knew many of it, but still it was a refresher. Now we welcome our next speaker, Ms. Jyoti Patel. She will be enlightening us about promoting early diagnosis of lung cancer. The early diagnosis of lung cancer is a very important aspect in lung cancer. As you all know, if diagnosed early, lung cancer can be treated and we can have a good outcome. So, to introduce Ms. Jyoti. Ms. Jyoti is a senior nursing officer with Tata Memorial Hospital, and she has an experience of more than 28 years. She has done her master's course titled Good Practices for Planning and Implementing Breast Cancer Project. She has done her MSc in Counseling and Spiritual Health from Annamalai University, Tamil Nadu. She has a huge experience of 30 years in TMH, and she has also researches to her credit and has presented papers at national and international level. I welcome you, Sister Jyoti, to present your topic.
Hello. Now, can you tell me promoting early diagnosis of lung cancer? What is the nurse's role? Anyone knows? What to early diagnosis? What we have to do? Huh? Screening. What is the meaning of screening? Screening is the person who doesn't have a sign and symptoms, and we are doing that is the screening. And therapeutic means the person is having sign and symptoms and they are coming to us. So in preventive oncology, we are doing the screening. Okay. So promoting early diagnosis of lung cancer. Already ma'am told, because in India, thank you. So worldwide, 19.3 million new cases, in almost 10 million death occurs in 2020. Female breast cancer has suppressed lung cancer as the most commonly diagnosed cancer, with an estimate 2.3 million new cases followed by lungs. So you can see, because now the lung cancer is increasing. Lung cancer is the most common cause of cancer-related death in the Western world. Next. Thank you. So in world you can see the lung cancer is the first number, whereas the India, it is in second. Now, causes of lung cancer. What is the causes of lung cancer? It takes about 20 years to develop, and cigarette smoking is the known as cause. Means it's not necessary. If the person has taken the 5 years smoking, so it's high chances of the lung cancer. Most lung cancer are most found early in the development of the disease. Regular screening is often to those considered to be high risk of contracting the disease. Now already ma'am told the cause of cancer: smoking, random gas, abstractors, air pollution and genetic. You can see tobacco in use. There are over 7,000 chemicals which will create a lung cancer. This everyone knows, but I have to tell one new things which one we are doing in Tata Memorial Hospital. Second-hand smoke. Now the second-hand smoke means where you can see in home, the husband, father, or any adult person is smoking, and that smoke is inhaling by the family members. Okay, so 38.7% are exposed. 30.2% adults who work in the indoor exposed second-hand smoke their workplace, and 7.4% adults were exposed to second-hand smoke in restaurants. Now, lung cancer screening can be early detection methods such as the testing sputum, CT scan, and PET scan already ma'am told, so I'm not taking. Now, the high risk of lung cancer, age of 50 to 77. You don't have a sign or symptoms of lung cancer. A person who has a current smoker or has a quit smoking within the last 15 years, and who has a tobacco smoking history at least 20 pack years, and 20 cigarettes per day 20 years, who had high chances of lung cancer. Sign and symptoms already ma'am told, other than also I'm telling chest pain, feeling tired, hoarseness, coughs, hemoptysis, weight loss, shortness of breath, new onset wheeze, bronchitis. These are the signs and symptoms of lung cancer. The lung cancer for screening, X-ray, and if the low dose CT scan can give the more idea about the lung. Any lesion is there. And the other diagnosis, chest X-ray, sputum, bronchoscopy, CT scan, cytologic examination, blood investigation, tuberculosis, pulmonary functions test. Now I'm telling the new things. These all the things I think before we knows everyone, right? Yes or no? So what the preventive oncology? What we are doing? Because when the lung cancer, why it's occurring? Already ma'am also told and I also told why it's occurring. Because of chemicals, smokes. So highly the person, traffic police, who are inhaling more smoke environment. Okay. So in preventive, Mumbai, all the traffic police, we are doing one project and we will see comorbidity. It's highly chance of the lung cancer. So here our health worker we have trained, and we are going to each and every their office, and every day we are doing the screening. I'll show you how we are doing. The screening of other respiratory morbidities for FOT, spirometer, PEFR, peak expiratory flow rate measure how effective we exhale, and a co-monoxide monitors. Okay. Now the FOD, this is the where we are doing in a traffic police office. This person is health worker. Assess the obstruction without. Already we have trained, and this project is conducting by the Dr. Tandon sir and Gaurav ma'am. And Mumbai full traffic police, we are doing the comorbidity. Okay. So assess the obstruction without the forced breathing through portable, affordable, oscilloscopy, quick testing, advanced interpretation, minimum training, effort-free lung test, most advanced FOT device. Spirometer. Spirometer, everyone knows how your lungs is working. Much air inhale and how much you exhale. Quickly you exhale. Spirometer is used to diagnosis of asthma, chronic obstruction, pulmonary disease, and other condition affect the breathing. Now, peak flow measurement is quick test to measure air flowing out of the lungs. Peak flow measure mostly done by people who have asthma. And co-monoxide monitor, a carbon monoxide detector, co-detector device that detect the presence of the carbon monoxide in that person. Now these all are the traffic police, and how much they have inhaled, other than how much they have a comorbidity like asthma and any allergic and anything. So we are finding, and it's in the future it's high chances of lung cancer. Now Everyone know tobacco is the main cause of lung cancer. So what the government is doing, and what is the Tata Memorial is doing? So start tobacco cessation clinic. Government told to start the tobacco cessation clinic everywhere. All dental medical college already has started. All district hospital, national hospital, dental clinic and counseling for TB. In our hospitals, I don't know everyone knows or not knowing, but ATRAC we have this is the ATRAC. So we have a helpline number who wants to quit the tobacco. Now why I am telling to you? Because we are the nurses, we can reduce the global burden of cancer. How? Just let me know. How we can reduce global burden of cancer, lung cancer? Because continuous around the clock we are with the patients, relatives, and if we will do the proper counseling, so definitely we can reduce the burden. So here the ATRAC hospital we have a one helpline. So you can say them to this is a helpline number, and if anyone wants to quit the tobacco, they can help them. How many people knows? Just let me know. In Tata, nobody is knows. So I have given the free information. Now you know the one message we are passing. If one message to how many people? Every day, how many groups we are passing to the message, right? Now, so that through social media also we can aware the people, but we are not doing. So this is the way also we should do. So I think today onwards we should start to aware the people. You can see here the how the nowadays children are smoking. But this is the MP Madhya Pradesh 13 to 15 years school children. They are smoking. So tobacco education institution government told to the object to provide the fresh momentum implementation of tobacco control initiate among the adolescent and young adults. All education institute including school and all level colleges for higher professional education university both in public private sectors self-evaluation score card to enable education institution to develop a healthy and tobacco free environment and also get certified as tobacco free in the assessment score is more than 90%. Now I am giving one new information because the I Can Care one app is there. If somebody wants to quit the tobacco, so we can tell relative. It's a free app and it's showing they can do the assessment of that how many per day they are taking the cigarette. Okay, and they are giving the planning, each and everything. How the, if we want to reduce the weight, the dietitian, how we are telling. So it's like that only. I Can Care app is there. Now more awareness about harmful effect and long-term health impact of tobacco use amongst the students, teachers, workers and officials in education institution. Awareness about various avenue available tobacco cessation. Better implementation of COTPA regarding sale and use of tobacco product, especially those related to educational institution, public place and statutory warning and minors. Even already in tobacco it's written, but after that the people are taking. Now, lungs, live life by understanding what not to do. Give up unhealthy lifestyle. So quit smoking. Goodbye to lung cancer. These things we have to tell the patient's relatives. Even when we can see in the mail ward, sometimes patient is admitted for surgery also, he is doing the smoking. He is going to the bathroom and he is doing the smoking, right? So let us take the plea to quit it. So how we can quit the tobacco to tell to the relatives? Just let me know. Through social media. And in ward, if once through social media also, and in ward, if we will counsel the relative, chain system, how the business we are doing the chain system. If in preventive oncology, we are doing the chain system. If the one person is coming to us, we are telling how many ladies in your home. They are telling 2. Just you bring 2 neighbor. That 2 neighbor will bring. Okay. This type we can aware the people. Thank you. Thank you so much. Any question? No question? Hope everyone everyone make one WhatsApp message for awareness and we can send to the social media. Thank you. Thank you. Thank you.
Thank you, sister, for this wonderful session. Very nicely, Jyoti has explained how to promote early diagnosis and has also covered the recent technologies. Also, she has updated us with many new things that are happening inside and outside our hospital. Very nicely, she has told us how to take ahead the chain system. Isn't it? We all should practice that. So that each one, we have a saying that each one teach one. Similar way, we also should, each one should try to bring about a change in a smoker's or a tobacco chewer's life. Okay. Now, as we have seen how to early prevention and diagnosis, but only diagnosis and what are the challenges faced in diagnosis. It is not easy to get diagnosed and treatment. So to discuss about the challenges in diagnosis and treatment, we have with us Dr. Ajay. Dr. Ajay is Assistant Professor in the Department of Medical Oncology in Tata Memorial Hospital. He has completed his DM in Medical Oncology from Tata Memorial Hospital. Also, he has many publications and paper presentations to his credit and has delivered many lectures in various categories like nursing, medical students and KVATs. I welcome you, Dr. KVAT, for the session. Dr. Ajay for the session.